Hi, I'm Kodashi Naomi and this is Health. In this episode, we are hanging out with Lungelo, a dental hygienist who knows exactly how to keep a mouth and a smile healthy. From studying at one of South Africa's top universities to now working at one of Johannesburg's leading dental practices, he has built real expertise. We chat about what a dental hygienist actually does, how he got into the field, the hidden risks of vaping and oral piercings, the tools he uses every day, and we even tackle some of the most common myths about keeping your teeth and your gums healthy. So, if you're curious about dental hygiene, thinking about a career in the field, or you're just looking for tips to keep your smile bright, this episode is for you. Let's hang out.
So a dental hygienist, we are focused on the prevention in dentistry. So you have dentists that fix problems, we prevent problems. So we detect early dental cavities, we prevent and cure gum disease, which might lead to other dental issues. We teach and educate on the importance of oral hygiene. So our work is very much on education. We do the dental cleanings. We do like small, minimally invasive fillings. We do teeth whitenings. So it's everything around the prevention of dental issues. And that's what we do. I always knew I wanted to be in hospitality. Like anything that helps, that allows me to help people. So it could have been medicine, physio, whatever it was. Social worker, counseling. I wanted to help people. So I never thought I'd look inside people's mouths. But yeah, I am, and I love it. Yeah, I wanted to be a teacher when I was young. I'm a people's person. I'm just work with people. So my journey into dental hygiene, right? I think late grade 11 into grade 12, I did pick up an interest into dentistry. I wanted to be in medical sciences, but I was like picking an interest in dentistry because I was very much, I'm infatuated with smiles and what they do to people and confidence, okay? So I always knew that someone who has a great confidence, they actually smile better. They're very appealing to someone's eye because of how they speak, which we very much focus onto the face, which we very much focus onto the eyes and the smile. So I think that's what interested me into getting to dental hygiene. Obviously, mainly the dream was to get into dentistry and become a dentist, but the journey led me to dental hygiene and I love it. I love it. I love what I do, the connections I have with my patients, because if your connection with your patients in terms of the hygiene is great, they never might need to see the dentist, okay? Probably they'll do like a yearly checkup, but they'll never need anything from the dentist, and I mean that. So also for our viewers, if you're very good with your hygiene and you go for your 6-month cleanings or you do your proper at-home hygiene, you might never, ever in your life need to see the dentist. So yeah, that's it. There is research that ties in lack of dental care with cardiovascular diseases. So like impairment of your heart valves or everything, or just overall problems with your heart. Dental neglect with diabetes, dental neglect with dementia. So literally, if you want to go into physics, there is a bacteria that causes a gum infection that if enters your bloodstream can go to your brain and actually start causing some neurological issues in your brain, leading to dementia. Yeah, it's all in the literature. So that's how important it is, man. Was this always the dream job? Yes, it was the dream job. I mean, when I fell in love with dentistry, I always wanted to pursue dentistry, which I did, and I completed my studies at UP. I always wanted to work in a very fast-forward, tech-forward establishment, in a very good place, like a fast-forward suburb. So this was a dream job, working for Thinc Sandton. Amazing tech, amazing facilities, amazing patients, learning quite a bit, So yeah, it was a dream job. After finishing school, I was approached by a dental company, Curaprox, which is a company I love. You might have seen them. They make really nice, very soft brushes with amazing dental aids, which we can go into in a separate video. But they approached me and they wanted me to be their sales rep. So they had a shop in Sandton City Mall and they wanted me to become their sales rep. And I did that and I loved it. That's where also my skill of people relationship grew into, like working with people, but now as a sales position. So the studying process is obviously I took pure math and physics at school with life sciences, with accounting. We're gonna get into that. Then enroll for oral hygiene, dental hygiene at the University of Pretoria. It's a 3-year course. First year, I think you're very much hands-on from the get-go in terms of practical and theory. So at get-go, you are learning the practicality of using the instruments, what to do, the procedures, obviously tied in with intense theory, which is all doable. And then you see patients right in your second year, you see your patients, so you learn those skills on the actual patient from there on. So I've seen tons of patients, did the procedures numerous times. So, because in this profession, the more you do it, the better you get. So yeah, 3-year course, final year, you do your hardcore practicals. You also get a chance of being in a, it's called the Pillow Paper Train. It's a healthcare train that brings about affordable medical opportunities to less fortunate backgrounds or environments. So a train goes around South Africa. There's 2 trains. It's called the Pillow Paper, and they bring about, nursing, pharmacists, dental hygienists and dentists, optometrists. They help disadvantaged communities with all that. So you do that in your final year, and that was cool. That was cool. You stay in a little small space, and you wake up 7, and you help people, and the food is amazing. Oof, take me back. So yeah, I did graduate top 3 out of my class, and I was the best orthodontist student in my whole class. So yeah, there's just a bit of academic recognition from there on, obviously courtesy of hard work. A typical day for me in the practice would have to be obviously clocking in at work at 7:30. I start seeing patients at 8 o'clock. Okay, so I see patients from 8 right through 5. Okay, so it's coming in, getting my room set up. So obviously disinfecting, cleaning up my chair, cleaning up the tools, the instruments, setting up my ultrasonic scaler. So that's an instrument I use when I do my dental cleanings. So this tool is one tool I cannot live without. This is my woodpecker PTB machine. So it's an ultrasonic machine. This is the tool I use to do my dental cleanings, which is the majority part of my work, okay? So I have my ultrasonic scaler, okay? So this removes all plaque and hard tartar that builds in between at the back of your teeth if you're not cleaning properly. That might cause gum disease. So I use this tool that actually cleans it all off, gets it nice and healthy. Your gums get to breathe a bit more, and actually we help cure your gum disease. Then I also have an air polisher, all right? This removes soft plaque. It sometimes removes stains. So if you're a coffee lover, if you are a smoker, if you're a wine drinker, tea drinker, all that stuff. Yep. So this helps remove all the stains that can build up into your teeth. All right. There's different settings, different temperatures I can maneuver. If I'm under the gum a bit, there's different settings as well. I have different tips for my ultrasonic scaler. So this is the tool I use mostly during my day. So these are also some of the tools I use in my day-to-day. So you have your hand scalers. So if hard to reach areas, when I remove some plaque, you can use a hand scalers. Okay, this is another version of a hand scaler. to just getting deep into the gum to remove all that food and that gunk that's hiding underneath the gum. I have my mouth retractors, so it just helps retract your mouth. So I can take nice pictures. I can also show you, when I take pictures, I can also show you areas of concern or some areas I want you to focus better on. This is people's favorite tool. If you see this, you know what this is. This is a local anesthetic syringe. So people, when they see this, they freak out. Most of the time, when I do my cleanings, if it's a deep clean where stuff is under the gum, which can be slightly uncomfortable, I just numb you up a bit with some local anesthetic, just so you don't feel anything. So I use this quite a lot. Okay, and this is my periodontal probe. Okay, so this has little markings. Okay, so I just insert it gently into the gum. So healthy gum is meant to have a short space depth, so it's called a sulcular pocket. But if it's deep, which is called a periodontal pocket, this tells me what the reading is, and I know you have a gum disease. Okay, so if it's healthy, it should be just a small pocket there, like 1 to 3 millimeters. But if it's deep, goes full all the way, I know you have a gum disease. You've lost some bone, you lost some gum tissue. There's probably stuff underneath the gum there, which is why you need to see me for deep cleaning. So one myth about dentistry that I would love people to stop believing in is the fact that if there's no problem or no pain, then you shouldn't see the dentist, which is a big myth, because just like any other condition, something could be brewing slowly over time. Okay, so it's always important to just pop in for your yearly checkups and your 6-month cleanings to make sure we detect the problem while it's still small, and also prevent the problem from worsening, and we treat it at that. So just because there's no pain or there's nothing going on doesn't mean there's nothing going on. Please come have a checkup and see if we give you a thorough check that, oh, okay, everything is good. So yeah, that's one myth I'd love to debunk. And grinding teeth means this could be something wrong with your jaw, or you're a stressed individual. So I can tell when someone is stressed. I can tell someone who's a mouth breather. So someone who suffers from sinuses, I can tell what's in the mouth. I can tell when someone has an addiction of something, which could be something acidic, like sparkling water, energy drinks. I can tell from that. I can tell someone when they like apple cider vinegar, lots of coffee, turmeric, spices. I can tell from that from just looking inside your mouth. So that, I think, is something cool about the job. But mouth is a mouth, eh? Mouth is a mouth. So my thoughts on oral piercings is, I'll tell you this: if someone is watching you and you had a smiley or a tongue piercing, if you still have it, great. But most people don't have it, and it's for a reason. Okay? In terms of a smiley, it's attached to a very delicate part of your mouth tissue, right? It's very soft. You might know taking care of it was very daunting. You have to be very careful. It's very painful, and I've met people that it has ripped. So it's a very soft piece of tissue for you to put a piercing on. It will rip. Most people it has ripped. Most people have taken it off. So if you think of doing it, please don't do it. And guys, time for smiley is done, eh? It's all done with. In terms of tongue piercings, we've seen most of the time, because this is a thing that irritates your tongue, most of the time people push it against their teeth. And because it's a piece of metal, it irritates, scratches a piece of your teeth. So I've seen someone who probably would have a hole right in their bottom teeth, and they've told me, oh yeah, I've had a tongue piercing for over 15 years, and I've been just scraping, piercing, and just dilly-dallying over their teeth, and actually causing some harm. It also causes some harm on your palate, because it's always rubbing in at the top of your palate. So my chat is, don't do it. And sometimes it doesn't go as great. You can have an infection, so your tongue can go very infected. You have a gangrene. So yeah, don't do it. My chat, don't do it. All right. So if if there's any kid at home watching this and they want to do what I do or Lungelo does, my piece of advice is, from a school level, always be sure what you want to do, okay? And as cliche as it sounds, you just have to work hard, okay? Obviously, there's subjects that you need to partake in for you to come into this, mostly the science world with math and all that. So obviously, you want to have to work really hard, develop a love and understanding for physics or math. And when you go to tertiary level, which you have to work hard into getting into uni or university, then when you're there, again, all you have to do is make sure you outsource everything you can, like ask questions in class, get extra study material. Always go the extra mile, because that sets you apart from the rest of the class. It sets you apart from everyone when you just do things different, okay? Always work hard, always reach out, ask for help, do more than is expected of you, because yes, you're doing it for you, but also someone is watching. And you work with people, and if someone sees that, they know that, you know, Naomi or Lungelo works really hard. So whenever you need something, you will get it, okay? So always try to knock on doors that are very sealed. So this is now outside of studying. If you do get your degree, which everyone does, how do you get into a well-established practice or find yourself in a good place? Try to knock on doors, okay? Not all doors are just open for you to just come in, but try to knock in there. Just create, be irritable to the next person that side, to say, this kid is just knocking in, what's going on? And you want to go in and you want to pierce through those barriers, those bubbles, make yourself heard. Let them see what they're missing out, what you're all about, you know, the cool factor. And I think just believing in yourself and knowing what you want to do, you can occupy any space in the realm of working. One golden nugget advice to everyone watching about your teeth, okay, is it is beyond just brushing your teeth, okay? Because we all brush our teeth. Hopefully, please. We all brush our teeth, and it should be morning and night, strictly non-negotiable. Morning and night, brush your teeth. But also, teeth is very much also tied into what you put inside your mouth. So it's not about just cleaning, but also what you put inside your mouth, because some food substances can badly harm your teeth, right? So please watch over your diet. Please be wary of what you put inside your mouth, what you take, what you drink inside your mouth, because it can very much affect your teeth, okay? And cleaning your teeth, like you're brushing your teeth, does a fraction of the job that your mouth needs, okay? So flossing plays a huge role in cleaning in between your mouth, rinsing your mouth, okay? Just to make sure you just get all that gunk that's just lining your teeth out. And very important, please just go see your dentist and your hygienist. Even if you can see us once a year, please just get in there. You will find out things you never thought were happening inside your mouth, okay? So the key is, it's not just only your brushing that you do, but also what you put inside your mouth, and also go in for a checkup or a cleaning. Gum, make sure that always you chew on sugar-free gum, okay? So gum actually stimulates our saliva production, and your mouth loves it when there's saliva around. Actually, it's better for you to have a lot of saliva than to have none. You have more problems when you don't have saliva, which is called xerostomia, which is called dry mouth, than when you have a lot of saliva. Saliva helps clean your mouth, so that's good. So always chew on sugar-free gum. Obviously, look out for sugar. Sugar is really, really bad. That's like the destroyer of teeth. Look out for acids. Okay, so these Cokes and these sparkling waters that we love and drink, bad. Okay, because also the acid with the sugar, those guys are bad. They're very good friends into damaging your teeth. So soda water, sparkling water, sugars, lots of starchy food, okay? Which is a bit of a hot take. A lot of starchy food, the carbohydrates help fuel the bacteria, some of the bacteria that causes issues in your mouth, okay? So all these breads and the pies and biscuits and spaghettis and all that, yes, we can have them, but just like in a very moderate rate. So look out for those. Lots of spices will stain your teeth, like your coffee, your red wine, as we've said. They'll always make your teeth look yellow and dull, but you can always reverse that with teeth whitening. Yeah, so those are, oof, I almost forgot. Vaping. Listen, guys. Hookah, shisha, or habli, vaping, and worst of all, cigarette smoking or substance smoking like marijuana or weed is bad for your teeth, okay? In a sense that you would never imagine. Tons of research tied in smoking with oral cancer, literally as blunt as it is. So you are very much putting your oral health at jeopardy when you smoke, okay? It's all about the vasoconstriction that, you know, tobacco has or cigarette smoking has on your teeth, the warming of your mouth, because when you smoke, you warm your mouth a lot, and some bacteria thrives in warm conditions. Just overall, the staining you put onto your teeth, very bad. Not just only teeth, but we all know this, also your lungs, okay? So smoking is really, really bad for your overall systemic health. So please watch over it. Get a bit of counseling, do some other replacement like your patches or your cigarette gums, or just stopping as a whole, you know? If you can, go for it. But really, really bad. That's like number one leading cause of dental issues, decay, gum infections is smoking. What's the worst snack that I think is worth risking your teeth for? First of all, beverage is coffee, because oof. And everyone loves coffee, eh? Like you just get that fresh cappuccino on a special or cafe mocha or whatever it is, but oh my God, beautiful. So for beverage, I would risk, you know, my teeth for like some coffee and some red wine, but let's not get into it. Snack, oh my word. Oh my God, I don't know. Oh, biltong. Ish. I think if you're South African, of course, hey, biltong goes hard into your South African instincts. But yeah, I think I'd risk dental health for biltong. I love biltong. I don't eat it as much because of course it gets stuck into your teeth and you never had floss around. And toothpicks are bad, guys. Please, always use dental floss. No toothpicks, please, because they're very thick and they can actually cause holes in between your teeth and actually damage your gum because it's a thick thing. So you'd rather use the normal thread floss, okay? So yeah, biltong. I think biltong. I'll give biltong like fresh right up biltong. Yeah. Like hot biltong or like after a very heavy night. Yeah, I'd risk it for some dental health. Most people have dental phobia, which is a fear of dentists across everyone, because we all remember the time your tooth was so painful and you had to go remove it and you had to big injections and it was just a nightmare, okay? Dentistry is not that bad, okay? Because there's a reason why I'm here, for you to not get toothache, for you to not be in pain, to then have your tooth removed, to then have a horrible experience. And I would say this, new age dentistry is actually not that bad. It's pain-free at all, actually. Like giving off anesthetic has become pain-free by using, numbing gels before giving anesthetic, or the STA machine that gives very pain-free injections, using laser sometimes to open some cavities. If you have a cavity, use some laser, so you don't have to use the drilling process. it's not that bad. Just make sure whichever dentist you go to, ask them about the equipment and how they'll do this. Like, doc, how are you gonna do my crown? Or how are you gonna do this? And let them explain it, because I think when you're aware of what you're gonna do, you're very much calm about it, okay? So know about what you're gonna do. Let them run through the process. You're gonna be very much calm about it. But new age dentistry, and especially where you are and the type of equipment they use, it's really, really calm, okay? So go in for a checkup, all right? So a checkup, they'll never even do anything to your teeth. They'll just have a look. They'll take some diagnostic photography, diagnostic radiographs, just to tell you what's going on in your mouth. And that's the only thing you need. When you have an understanding of what's going on in your mouth, you actually treat it better. Don't go for a hectic procedure. Just go for a routine checkup to see what's going on in your mouth. And I think that's how we debunk some of these dental phobias, okay? Come see me, I'm very gentle, right? You never even know that I'm working, because I'm very gentle. So yeah, just get understanding of what you're doing, know about it, get the instruments that are being worked on, do a checkup. All of this will relieve all your dental phobia. So this is a CVCT scan, right? So it's a radiographical view of your actual lower part of your mouth, okay? So we can see actually your sinuses, we can see the teeth, we can see the bone level, okay? This shows us if your sinuses are infected, if some of the teeth that are painful, they have abscesses, because abscesses are all the way down by your alveolar bone. So we can see all of that. I can assess if your bone is healthy, if there's any fillings extending into your nerves, right? So you see this clear space here, that's your sinuses. If it's not clear, I can see that, oh, okay, your sinuses are actually quite inflamed, okay? We can bring about a lot of diagnostic value with all these radiographs.
On that other picture is the black stuff cavity.
So you mean this black stuff? No, that's your nerve.
Oh.
Okay, your nerve is inside here. So if you look at this one, that's the black stuff there. That's your nerve. But if there's black stuff just close to the white part, that's a cavity. It's just knowing the normal, being able to set it aside from the not normal. Okay. Then this is a pan view. Then you can see what's going on with your teeth in a panoramic view. Hi there, my name is Lungelo. I am a qualified dental hygienist in the heart of Sandton, Thinc Sandton. And this has been amazing, hosted by Hout. Peace.